Hello, Dr. Will Kalla here. I'm just arriving here to Oman to meeting with the organizer for scoliosis in Oman. We just had a group meeting here for the presentation on Saturday, where we were talking about sharing the information with the general public here in Oman about scoliosis. I'll be sharing some information based on research and what we know about surgeries and the downside of surgeries, and I'm going to explain a different way of looking at scoliosis and explain how I do the treatment for it.
بسم الله الرحمن الرحيم. الحمد لله المحمود على البلاء، المرجو لكشف البلاء، المرجو لكشف الضراء، والمسؤول لدفع البلاء. وأصلي وأسلم على من أخرج البشرية من المرض الحق الذي هو مرض البعد عن الله تبارك وتعالى، وإلا فإن كل مرض بعد ذلك هين ويسير. أما بعد، فيا أيها الحضور المبارك، أحييكم بتحية الإسلام، فالسلام عليكم ورحمة الله وبركاته، وأهلا وسهلا ومرحبا بكم في هذه الندوة التوعوية حول مرض الجنف، والتي تقيمها المجموعة العمانية للتوعية عن مرض الجنف، وبحضور الدكتور ويل كالا، وهو طبيب معتمد من مؤسسة كلير. أيها الحضور المبارك، إن العافية في البدن من نعم الله على العبد التي تلزمه أن يشكر الله عليها، وسؤاله تمامها ودوامها. فقد قال الرسول صلى الله عليه وسلم: سل الله العفو والعافية في الدنيا والآخرة، فإنك إذا أعطيت العافية في الدنيا والآخرة كنت من أهل الفلاح. أما الآن فأستأذنكم أيها الحضور المبارك لنشاهد العرض الذي يقدمه رئيس المجموعة ومؤسسها الأستاذ طارق بن سهيل الشيباني.
Hello everyone, my name is Tariq Bin Sebani. I'm the founder and president of Scoliosis Awareness in Oman. And so, apologize for the delay we had. Okay, so what we'll be talking about today is, we'll be defining who are we as a group, and what is scoliosis, and why have we started this campaign for a group, and how big is this cause really is in the Omani community, and our story with Clear treatment. And we'll have some statements from people who are suffering scoliosis. And we'll also be presenting Dr. Will Kalla to be explaining the treatments with scoliosis. And we'll have a question and answer session at the end. Okay, I started this as a Facebook group page. When we started this, it was out of curiosity actually. I thought I'm the only one in Oman that has scoliosis, which I'm currently not. So when I started this as a page, I didn't expect to get many people or responses, but I started to find out a lot of people that have scoliosis, and some of them were my own classmates and my cousins and etc. And our aim is to spread awareness on scoliosis and promote early non-surgical intervention on scoliosis. So we're not just spreading awareness, we're encouraging people to get screenings and know scoliosis, to detect scoliosis earlier, so they can have an early non-surgical intervention for scoliosis. Okay, so a lot of people ask me that, what is scoliosis? Although it's a very interesting word to hear. For me, at first when I heard the word scoliosis, I thought it's a Filipino word. I didn't think it's even English. So scoliosis is an abnormal curvature of the spine. I don't know if you can see over here. The spine is curved. It can be curved like in a C shape or in an S shape. And for the treatment for scoliosis that is offered worldwide is, first we're going to get observation. We're going to see if you're going to get worse or not. And as you progress, we're going to put you in a brace. And if you still keep on progressing, we're going to have surgical intervention. And right now there's an alternative treatment for scoliosis. I'm not sure if you can read it. You have the clear and Scoliogold and Scrofman. These are three well-known treatments for scoliosis with non-surgical treatments. For us, we tried the clear method, and alhamdulillah, it works perfectly. So why have we started this? First of all, according to estimates, scoliosis affects 2 to 3% of the population. So that's around 60 to 90,000 people in Oman itself. If we say our population is around 3 million people. And 90% of those that have scoliosis are idiopathic. That means their cause is unknown. And the alternative treatments usually can treat most of our idiopathic scoliosis patients as long as it's detected earlier. It will be easier to treat. And this is a note that I tell everyone that all big curves started small. So some people will say, oh, I have scoliosis, but that's 15 degrees. But you have to realize that guy who has 100 degrees, it was once 15 degrees. So you better act on it now and later on. So how big is this cause really? This is my drawing actually. And there are a few newspaper articles actually that were mentioned scoliosis. One is from the week, by some bent back. They included me and 2 orthopedics, where they're speaking in scoliosis generally. And there's another one called Medics Urge Expertise Against Scoliosis in Oman. This is the most interesting article. I'm not sure if you can read this. Here it says that around 2 to 3% of the scoliosis patients, they do have scoliosis, but I don't think you can read this. It says that 10 or 15 people have been detected in the last 5 years in Hula Hospital. So this is a bit of contradicting information, because if it's 10 to 15 people out of 60 to 90,000 people, that means there are a lot of people who have gone undetected. And so that's why we're using awareness in this country. So a lot of people keep on asking me, how common is scoliosis? Is it a few people? Is it a lot of people? So I will show you this. I'll tell you a bunch of people that I know. This is my friend's cousin, my maternal cousin, my paternal cousin, my classmates, my other classmate, my cousin's classmate, my cousin's neighbor, my dad's co-worker's daughter, my dad's friend daughter, my scoliosis friend cousin, my high school friend, my family friend daughter, my scoliosis other cousin. They all have scoliosis. This is 14 people that's just around me. So there are even more than that. So our clear treatment story. When I first discovered my scoliosis, I went for a brace for 1 year, and then I stopped with the brace. And I was researching online for treatments that's available. And I came across with clear treatment, and I came to know online with Dr. Will Kalla, as one of the founding directors of Clear Institute. And he kept on teaching me and giving me research papers that supports alternative treatment. So 2 years later, after researching and all, I decided to go to Dr. Will Kalla to have a treatment. And alhamdulillah, I had the successful treatment. My curvature dropped from 40 to 27 degrees in 4 days. And when I came back and I showed people my x-rays and my results, a lot of people went there for treatment. Actually, it's more than 10 people that went there, and it's not just in Oman, it's all around the Middle East. We have people from Egypt, and Saudi Arabia, and Jordan, and UAE, they're going for retreat. So this is scoliosis body story. Just read it real quick. This is from Faisal al-Busaidi. He said, one of my best friends had scoliosis and went through the surgery. After her surgery, she noticed that my back, and we decided to try a forward bending test. The forward bending test is a test you do to detect scoliosis. I'm sure that Dr. will be explaining that. Okay. That's when I discovered that I have the double curve and immediately start physiotherapy. I am feeling way better now, and hopefully we'll keep on working hard. As you notice, that a lot of people that have scoliosis, they're unaware of. So they just detected that it's too late. It's 40 degrees or more when surgery is needed. And this is from Amira al-Haki. She said, I was diagnosed with scoliosis 5 years ago. Scoliosis 5 years ago, but when she was 30. When my mom noticed a serious lump on my back, we immediately went for an x-ray. And upon seeing the unthinkable, we packed our bags 2 years later and headed to Pune, India, to treat my S-curved spine. 60 degrees at top and 30 degrees at the bottom. Her curvature was very progressed when we found about the operation time span was 8 hours long. It turned out successful. I'm feeling better than ever, and my back is almost rare. As for my breathing, it has gotten better, not my health, not healed, but better. That's what happens when you discover it late in the stage. You get to treat it, but it's not 100% treatment. You still have other complications that you'll have to live with your whole life. And this is another statement from Sindhis Al-Hashmi. She says, my story began when I noticed my hips were uneven at the age of 13. It has not been easy ever since. I went through physiotherapy and bracing, but unfortunately both did not work out for me. Once my spine reached about 55 degrees and breathing became difficult, doctor advised it would be best to go for surgery, which I did in 2011 in India. My spine is not 100% straight now. I still have a minor curve on the thoracic region, which is the top region of the spine, but my lumbar curve is straight. This is the bottom spine. Ultimately, the surgery was successful, whereas my breathing and posture has gotten a lot better. As you see here, when you discover it later in the stage, we don't get 100% correction. We still have those issues and we still have to live with it. Okay, so after now explaining who we are and what scoliosis is, we'll have Dr. Will Kalla to come up to the stage and explain regarding the treatment of scoliosis.
Can you hear me? Good. All right. Hello, I'm Dr. Will Kalla. Sorry, we need to get all the slides going on here first. All right. I'm a chiropractor, and I've been working with a lot of scoliosis patients for the last 6 years. So today, I want to be doing a presentation here. And we want to talk about Scoliosis Bootcamp, the treatment protocol that I'm doing. Alright, we want to be covering the risks and concerns that a lot of parents and children have about scoliosis. We want to be talking about the different types of scoliosis briefly, and then we want to talk about the cause. Traditionally, scoliosis has been looking at a bone problem, and they might be seeing that the bone problem that curve spine is a secondary disorder to a neurological problem. So we're going to show some evidence indicating that. We're going to talk about the traditional treatment of orthopedic doctors, what they do in bracing and surgery, and then we're going to talk some of the treatment results that we obtain and see in our treatment. So, scoliosis by definition is that you have a curved spine, bent spine, you have more than 10-degree cold angle. Okay. Tariq was mentioning about the forward bending test. Basically, if you have any children, anybody you want to be screening, you just ask them to stand like this, looking at the hips, ask them to put their hands together and leaning forward. What you'll be looking for is that one side, usually the right-hand side of the ribs, will be bulging out. Okay, that's considered a positive Adams test, forward bending test, and that then you want to be confirming that with an X-ray if they have scoliosis. So the common risks and concerns that I have when parents coming to ask when they have scoliosis is heart and lung problems. They often see an orthopedic surgeon and say that you need to have surgery because you're going to have some problem with breathing on your heart. They will also state that your lungs are your organs are going to be compromised or compressed because of the severity of the curvature. This was a long time thought that there was a lot of people actually died of scoliosis, heart lung failure. What it doesn't apply though is that if your scoliosis has been found out after the age of 5, then this does not apply to you. So if you do have somebody and you find the scoliosis before the age of 5,
they do run a severe risk of having heart lung failure in the early 20s. But adolescent idiopathic scoliosis, that's the majority of the group of scoliosis patients, and that they're dealing with also. If you're looking at the age of 5, your heart and lungs are mostly developed. What I mean by your lungs being developed is that the lungs have fully branched out. If you're looking at a tree and the branches keep branching itself out, so your lungs are pretty much, all the branches are in place by the age of 5, most of it. So even if you have scoliosis after that, you're not going to be compromising the circulation of the blood. So you're not going to be stressing out your heart. So that's not really a concern. The other risk that we're looking at is early stage of curvature. Unfortunately, with this screen you can't see this. If you have a 20-degree curvature or below, your risk of progression at an early stage, when you're younger, is close to 20%. If you have up to 26-degree, 30-degree curvature, your chance of progression, risk of progression is up to 68%. If you do have a curvature close to 30 degrees, you're pretty much definitely that you're going to be progressing. About 90% chance of that. So the other area of concern that people are having is radiation. Okay, they're always concerned that, okay, I need to do an X-ray and radiation, so they're always afraid of that. Radiation in modern days are fairly safe for X-rays. The chest X-ray, if you were to do a normal chest X-ray, it's the same amount of radiation that you receive if you fly in an aeroplane for 4 hours. So it's not really a concern, and not too big of a concern anyway. So what we need the X-rays for is to see how the scoliosis curve is formed. So you do the Adam test, the forward bending test, and then you can visualize the curve with the X-ray itself. How you want to be measuring the severity of scoliosis is that you want to be doing something called a curve angle. And it's a very common word, everybody's heard of it, in scoliosis anyway. So what they do, they measure the most tilted segment, most of the vertebra at the top, they measure the most tilted vertebra at the bottom here, and then they measure the angle here, the intersection angle. And that's called the curve angle. Curve angle is actually written by Dr. John Cobb in 1948. So it's actually a medical doctor case that he made for the curvature. The other thing here, what you're looking at, I have a lot of people that say, okay, I have an S curvature or C-shaped curvature. What's the definition for an S curve? If you draw a vertical plumb line here, the curve wants to go to one side and then deviate across the. So what we need the X-rays for is to see how the scoliosis curve is formed. So you do the Adam test, the forward bending test, and then you can visualize the curve with the X-rays itself. How you want to be measuring the severity of scoliosis is that you want to be doing something called a curve angle. And it's a very common word, everybody's heard of it, in scoliosis anyway. So what they do, they measure the most tilted segment, most tilted vertebra at the top, they measure the most tilted vertebra at the bottom here, and then they measure the angle here, the intersection angle. And that's called the curve angle. Curve angle is actually written by Dr. John Cobb in 1948. So it's actually a medical doctor case that he made for the curvature. The other thing here, what you're looking at, I have a lot of people that say, okay, I have an S curvature or C-shaped curvature. What's the definition for an S curve? If you draw a vertical plumb line here, the curve wants to go to one side and then deviate across the midline over to the other side. These are the very common patterns that you have. The bottom one goes to the left and the top one to the right. If you have a scoliosis actually going at the top of chest level to the left, that's the reason for doing an MRI. The reason why it almost always goes to the right is because you have your heart here, you can see that in X-ray. That's a solid mass, and the main aorta, the main blood vessel in the body. It's actually too hard for the spine to push against it. So that's why it's always, in 90% of the cases, it always goes to the right. So this is definition of thoracic curvature, apex, thoracic spine. Lumbar curvature, the apex is usually LCL4 there. And this is thoracolumbar curvature, just meaning that the apex of the curvature is the junction between the chest and the lumbar spine. as for cause, there's been proposed a lot of things for scoliosis. We still don't really know the real reason for it. Hippocrates was the first one to explain no crown scoliosis. They did some funny treatment back in those days. Not so bad if you think of it, what they knew about it. So they've always been considered as a bone problem. And that has sort of dictated the treatment that we've done the last 150 years of it. They've been looking at hormonal reasons for it and some other, a lot of other different reasons. But one that is very interesting from our perspective, what we can actually treat and possible cause of it, and it's been surfaced in the last few years, is more of a neurological problem. I'm going to just jump a few slides here first to get to this. So this is a person standing on a normal force platform. They're measuring how well they can balance themselves. So this is a normal person, and they'll look at the center of the platform, and they can pretty much keep the center of gravity in place in one spot. If you compare that to a person with scoliosis, they'll keep it a little bit here, then deviate around here, and then sort of go back. So they have a problem of keeping the scoliosis around here, and then sort of go back. So they have a problem of keeping the scoliosis balanced, and they keep shifting all the time. That's why they say that people with scoliosis like to be clumsy and other things. So the reason why they were looking at that is that they came up with something called sensory integration hypothesis. This paper was very interesting, published in 2006. So what they did in this paper is actually, they took normal people and people with scoliosis, they asked them to close their eyes, and then they put vibration on their tendon. So they had to rely on their balance, just on the balance holder in the inner ear. So when the normal people, both people did that, they pretty much had the same balance. When a normal person without scoliosis opens their eyes and they stop off the vibration, they immediately regain their balance. What was interesting when you did that with a person with scoliosis, they momentarily lose balance. So they were having proposing that there's a sensory integration. The problem is that they can't sync the information from vision, balance, and the joints of the body. And that seems to be having a problem for them. So they started doing a lot of work on that, and they've been following up with a few papers after that. But that seems to be very interesting for us, and that's something we can actually start working with. So that particular paper was altered sensory rating mechanism observed in adults with idiopathic scoliosis. Simone, French-Canadian, very interesting person, written many interesting papers with this topic. And it's actually freely available on the internet, published in 2006. That same research actually part of this paper was published in the European Journal of Spine in 2009. Medical Hypothesis is a journal. They keep giving different reasons for different diseases and conditions. So they publish a hypothesis there, and they sort of get other doctors to challenge it. So this was published actually in 2013, and Simone was here again. So that they're looking at vestibular motor. So they're looking at the balance organ being a part of scoliosis. And what they were saying here, that scoliosis onset and curve progression could be expression of a subclinical vestibular motor disorder. So there's been a lot of studies been looking at that, and we have a lot of research and research papers pointing that there's a neurological problem. Could be the cause of scoliosis, and scoliosis itself to be just a subset, a symptom of an underlying neurological problem. So what they're proposing that we should actually investigate if that this is the case. Alright. So the vestibular organ, the inner ear, these are the three channels actually that they're measuring how head positioning and acceleration, just measuring movement for our head. So it's our own accelerometer inside our head. That's what the eyes want to use, just a miniature of it. Alright. So this would be then dictating the treatment that we're doing. Traditionally, orthopedic surgeons have been doing treatment like this. What they've been looking at is, this is a sort of a logo that the orthopedic surgeon already accepted for himself. This actually was published in 1741, and they were looking at a crooked tree post, tied to a strong post. So they want to be correcting a tree like that. That's sort of the basis how they're doing bracing also. And they were looking at basic orthopedic surgery and bracing. So they are viewing it sort of as a bone problem, and if you can just press the bone in position, it will make itself straight and hold itself there. Unfortunately, That's not necessarily the case. This is a Boston brace traditionally used for treating scoliosis, the most common form of bracing. This is probably the one that they give to every single one. They were looking at here, there's something called the Scoliosis score test. It's working in the United States. It's launched a few years ago. What it's looking at 53 genetic markers and looking at to predict the likelihood of you having scoliosis to progress to surgical levels. So James O'Gibley was actually wanted to develop that test. He looked at people with bracing and the outcome of the results of the bracing, what happened, and they were looking at what was the progression score that they were using, what was the results and outcome. So if you use the brace, you test with genetics, you can actually show that bracing was not effective at all. So the ones that the case that brace actually worked for was actually the people that had low genetic risk of actually progressing anyway. This was an oral presentation. Unfortunately, you can't see it too well. It was, you can find it in Scoliosis in 2009. So this was presented in social media. Then we get back to surgeries and the recommendation that medical doctors give to surgery. My problem with surgery, what I think, is that I see a lot of cases that they've gone to see a doctor that have 40, 45, 50 degree curvature, and the doctor says, okay, you're 45 now, you need to go for surgery. The problem with that is that you just have an arbitrary number, you put a number there, and say, okay, now it's time to go for surgery. There's no evidence actually stating that there's the need for the surgery. So this was published in it was 2011, so supplementary journal, and they put it in here. And this paper was stating here, no long-term prospective control studies exist to support the hypothesis that surgical intervention for AIS, adolescent idiopathic scoliosis, is superior to natural history. So what they're saying, that doing a surgery is not going to improve and change your life. Okay, it's not going to improve your organ function or anything like that. What they were saying, that although surgery reliably arrests the progression of deformity, achieves permanent correction, and improves appearance, there is no medical necessity for surgery based on the current body literature. So they've been doing surgeries for a long time, and they still haven't gathered any kind of evidence to say that surgery is better for your life. All right. In Spine Journal, probably considered the most important journal for orthopedic surgeons, the most recognized journal. They had an article published in April this year looking at the quality of life of people for idiopathic scoliosis having surgeries done for them. So evidence suggests that surgery can lead to clinically important improvement in patient self-image. So what they're saying, that the only finding that they actually find that scoliosis was good for is to self-esteem. So good self-image means that, okay, you look straight, it's a cosmetic procedure. So that's what scoliosis surgery is good for. So what I'm going to be looking at is orthopedics having the role of doing things, using bracing and surgeries. I want to be looking at a different alternative treatment that we're doing. We call it Scoliosis Bootcamp. Alright. We're just we're approaching it from a slightly different point of view, looking at the more of a neurological problems and not a bone problem. What we're doing is the patients, we want to be loosening up the patient. This is basically a normal traction chair. So some cases are very stiff in their spine, and you need to work a lot of mobility in there to loosen up, to make it more pliable. We use the scoliosis traction chair for them, and then we do some spinal manipulation, and then we give them rehabilitation exercises. Okay, we want to actually retrain their balance and posture, and so they can hold it there. And you can do that for about an hour each day at home, and you can get some nice improvements of that. So it's a completely different idea than to wear a Boston brace for 20 hours a day. That gives you a lot of problems. So what kind of results can we see? This is a female, 21 years of age. She started with a thoracolumbar buckle of 19 degrees. We managed to bring her down to 11 degrees. So these are the cases that I've done in the last probably 12 months. Not all of them, some of the cases. This has had a curvature of 24 degrees, 16 degrees, and to 14 and 8 degrees. It's a 12-year-old girl. So age doesn't really be a big difference, impact on it. If you're 40, 50, 60 years old, then definitely it's going to be a much stiffer curve to work with. Here's a bigger curve to 59 degrees. We brought it down to 47 degrees, and that was on a 28-year-old person. Another one here was an S-curve. S-curves are always harder to work with. There's C-curve, 47 degrees at the top went to 43, 48 down to 38. Each 13 curve here again. Here was a C-shaped curvature, 34 degrees down to 26. You can see that the shifting reduced a fair bit here. Was a 17-year-old. 33-degree curvature, went down to 26 at 27 years. So we do see a fair bit of variability of results here. We don't always get results. I don't have a 100% success rate. I don't think any medical treatment has that. So it's very important. I mean, I'm showing a lot of good cases here, so people coming to the clinic may expect that that's going to always happen. Not the case, all right? Here's a 57-degree curvature, a young girl, 12 years old. So it's very important that we screen them at early age, because you don't want to have somebody already a 57-degree curvature. If we could have caught this person at the age of 9, it would have been far easier to work with a hold the curve at a steady place. I mean, you have a nice reduction here, but it's still, even with nice reduction, it's still at 43 degrees. Small curve here of moderate, 29 degrees at 21, 20 to 13 at the bottom there. The challenge with these curves is that when you have somebody who's 12 years old, they're still going to be growing a fair bit. Okay, they're going to hit their growth spurt and all that. So what we want to be looking at, okay, we can make an initial reduction on them, but the more important thing, how will they look out after 2 years of time? I do not have that answer yet, and we're working on that to treat the patient for long term and actually see that we can hold these changes. There's also a case in the United States with this. There was a girl, she started at 47 degrees. 2 years after the treatment now, and 2 years in it, she's down and holding steady at 12 degrees. So she's gone through all her growth spurt. She was genetically tested to be a high-risk case. So showing a very good success so that we can actually change the natural history of scoliosis. So that's probably the first time that is done in any kind of treatment. That is not surgical. Here, another 24-year-old girl, 62-degree curvature went down to 48. You can see there's a huge shift of her chest here and improving her posture remarkably. This is a girl from Egypt. She's actually the best correction I've seen, percentage point, from a 26-degree curvature down to 8. She's technically not even having scoliosis anymore because the definition is 10 degrees. Interesting thing is also that she's 29 years of age. So we're very interested to see a follow-up on her when she has got the chance to come to the clinic again. 23-year-old male, 40-degree curvature, and down to 32. Some of you in this hall might actually know this person. This is actually a patient from Oman. Here we had a 75-degree curvature, went down to 60. So we can work on big curves and small curves. It's always going to be far easier to work on smaller curves than the very large curves. And even if you get nice correction from a 75-degree curvature down to 60, it's still a very big curvature that we're talking about. Alright. Good. So this is pretty much what I wanted to show you. I hope you have a lot of questions. Alright. Thank you for listening.
Doctor, I want to ask you about whether the muscles, the back muscles, interfere with the correction of the spine or with the orientation of the spine. Because I'm talking about myself. 1 year back, I had a very big curvature in my back. Yep. I still do have one, but it's much less. I started working on back exercises in the gym, but without doing any other thing that you mentioned. So I was wondering, is it related only to the neurological system or also the muscles?
You want to be you want to be retraining the muscles. I mean, even if you work neurologically on them, the exercise actually retraining how the body is actually feeling itself. A crooked spine, let's say, far over here with scoliosis, that person feels straight. So we want to recalibrate them to be, to be in a straighter alignment. They'll still feel straight here. What happens is that the muscles actually will be holding a different tension in the spine. Okay, so you definitely work on the muscles. The challenge is actually to work on the subconscious muscle, the postural muscles. They're not necessarily under voluntary control. So yeah, I mean, it's great. I mean, if you go to the gym and you start exercising, you start getting better, it's great. There is one lady that's been doing this some kind of exercise. She spends 1.5 hours every day. So a lot of people don't have the time. And she has sort of managed to correct her curvature to a great deal. Unfortunately, there's no standardized system to it. So, some people might be exercising, some might be getting better, some might be getting worse. So, I've been looking and reading a lot of stuff. I have gathered about 2,500 research papers. I read a vast bunch of those. So, anything that gives sort of consistent good results is the treatment system that we're working with now. So there will be, a lot of cases, the odd cases that, you get one good case of something. I mean, it's wonderful for that particular person, but we can't replicate it enough times and hit the 100 next ones.
And one more thing, you talked about the surgery and you said that it's permanent fix for at least for the orientation of the spine.
Yes.
What about your method? Is it also permanent after the treatment is done, or will you have to keep on doing things continuously to maintain it or even get it better?
Okay. What you want to be initially do, you want to definitely go through your growth spurt years. So let's say you start at the age of 12, you probably want to be working at 16, 17 years of age. To spend half an hour a day, depending on the size of the curvature. Statistically, if you have a curvature that is 26 degrees and above, you will tend to progress. If you get it below it, you can sort of hold it stabilized. So if you can bring a curvature at 12 degrees, down to 12 degrees, like 40 degree curvature, okay, and you hit 16, 17 years of age, your likelihood of any kind of progression is pretty much zero. We don't have the evidence to prove that yet, but statistically, if you look at other cases, there doesn't tend to progress.
So if I reduce my curvature, let's say 3 degrees at your clinic, and at an age that's normal growth is expected, so I'll be maintaining that even without doing any exercise or something.
During your growth spurt years, you definitely continue your exercises. But then it sort of becomes the definition, how big is your curve? Let's say you have huge curvature, worst case I think is double 130 degrees. So you went to double 110 degrees, it's a nice reduction, but it's still a massive curvature. And she will definitely continue progressing. Alright? So she's going to be happy fighting gravity every single day. So if you can bring your curvature below to, not close to 20s or below, then they tend to be stable on their own. Okay?
Thank you.
Another point that this seems to be noticing now that for ladies especially, menopause seems to be the second stage where a lot of curves seem to be progressing for some reason. That's something that they've been picking up for the last few years, so I'll expect a lot more research coming up on that to explain why that is actually happening. Yes? It is on.
You have a clinic here, or you have to come to Singapore?
Yeah, I have a clinic only in Singapore, unfortunately.
Only in Singapore?
Yes. I actually came here because...
No, the doctors, sometimes they come here and... No.
No, I can't...
What duration we have to stay there with you?
And those treatment exercises show there was a duration of 2 weeks.
2 weeks?
Yes. 2 weeks. So the treatment protocol is the best way to do a 2-week treatment. Then you go home and do exercise for about 3 months, 2 to 3 months. Then you come back to the clinic for 1 week sort of follow-up. You want to check up, did the home exercises work and maintain and do what they were supposed to do and further reducing the curvature, or do we need to make some adjustments to it? I can have 2-3 cases that looks identically the same on X-rays, and I end up doing 2-3 different setups for them. So I can't say, okay, you have a S-shaped curvature looking like this, okay, you will do this exercise. So the 2 weeks, what we're doing, we actually have to figure out which exercise responds to your particular person, alright? You as an individual. So we're going to be trying one, okay, this didn't give the result that we wanted to achieve, then we'll have to try a few other ones. Then we're going to send you home with one of the exercises that seems to be the most promising one, and we're going to have to evaluate it over the long term if it's producing the results that we want. So the case that my friend worked for 2 years, he treated it from 47 to 25 in the clinic itself, sent her home with the home exercises, and she came back after 3 months at 8 degrees. So that was, very good results of both. And then they'll be maintaining after 2 years, she was still at 12 degrees.
The growth stops exactly in age, isn't it? 24, 25, something like that. Still it grows?
Your growth age is teenagers. For growth, they usually stop at 16.
Because I took my son to one French doctor at Muscat Private Hospital.
Yes.
He said no surgery is possible now because he's already 24.
Okay.
So leave him as it is this.
Yes. We see that, if you look at adults, curvature above 26 degrees or 30 degrees, they tend to creep throughout age. Okay? They may be getting worse 1 to 3 degrees per year. When you have your growth spurt, I think cases that got worse, 6 degrees per month. So they went somewhere and did an X-ray, they were 30 degrees, they were in a brace, and 6 months later they were 60 degrees. So growth spurt can be really, that's when you have this rapid progression and degeneration of the curvature. It goes really fast. When you sort of hit skeletal maturity, you're looking at progression rate maybe 1 to 2 degrees.
So your system will work.
Okay, depending, it will work. It works for a lot of cases, works for majority of cases, doesn't work 100% of cases. Alright, I do have some cases that doesn't always respond. Some cases we may have to come the second time, we will figure out then what is the response. Okay. But yeah, there are cases that I have not, managed to help.
Thank you.
Doctor, your treatment is suitable for all age because I have a child is 3.5 years old. It is possible to treat, the child is maybe is not response for exercise.
There will be challenges, especially very young children. I haven't treated anybody below the age of 6. I tried on a 4-year-old, but we couldn't treat that particular person. Okay, I've seen kids that have been 2, 2.5 to be treated. It's not very pleasant because there's a lack of understanding for the child, and there's certain challenges, especially when you're looking at sort of balancing. So you may have to modify the treatment, but there will be definitely challenges. It's a lot harder. I know some doctors, they don't treat anybody below the age of 6. When she started this young though, was she born with it?
It's from 6 months.
6 months, so there's no congenital scoliosis going on?
It's congenital scoliosis.
Okay. Congenital, okay, just a brief explanation for the others. Just see if I can get an X-ray. Congenital scoliosis, what it is, that if you have a vertebra here, it's actually sort of wedge shaped. It's like a sort of a wedge. Either the vertebrae have fused together, or they haven't fully developed any vertebra or butterfly vertebra. There's a lot of different things. At some stage, depending how severe they are, they just go and pick up the piece of bone in there, which is a bit of a challenge on its own. How severe is the curve? How bad is the curve?
Now, maybe it's 57.
57 degrees.
Yeah.
Okay. She may be a surgical case.
Yeah. Don't do progress.
Yes, you can work on them. I know that some places actually done bracing for the really small ones, usually below the age of 2. They put them in a cast brace. So basically, like if somebody breaks a leg, you do that for the kids. But usually about 6 to 9 months. It's not very pleasant at all. Okay, but there are some good results in them. The challenge will be with a 3.5-year-old is how well can they stand and what we can do for them. Alright. The problem is because they're still growing at quite a rapid age. Yes. And also how severely is the wedge there. And you can work on a congenital case, but if their wedge is at 20 degrees, you'll never get any better than that. Alright. So if your wedge is at 45 or 50 degrees, they will have that pain in there. That's the best you'll ever get.
Yeah. But if your treatment is going to do for this child. I mean, maybe that the degree of the curvature is going to decrease. So yeah, after the treatment, that is, you have to continue that the exercise to keep that in the degree of the curvature. Stay at that what it is. That is, stay that degrees after the treatment.
If you look at somebody with 3.5 and you start working on them, consider that you'll be looking at a 10-year treatment plan for that particular person. Okay, and initially you may not even be able to work with them. Why is the challenge with children? Because we hit postural maturity. That's one of the reasons why they believe that scoliosis hits more for girls than boys, is because they hit the growth curve before they're posturally matured. Postural maturity sort of gets into about age of 15. So if you have somebody who's 3, the motor skills are not even fully developed. Motor skills are generally fully developed at the age of 4 or 5 thereafter. Okay, so if you have that motor skill developed and you want to start working on them to change them, and you want to put some balancing and other challenging exercises for them to posturally develop, may be very difficult. Right? You may want to be fine, you may be able to do something, but definitely you'll have to work on them before you can say anything. Thank you.
Good evening, everybody. Thank you, Dr. Will, for the great information today. I just want to ask about, I'm a bit concerned about female patients who went after pre-treating them with the pregnancy. Is there any interference?
Yeah. Sorry.
Well, after treating a patient, a female patient,
yes.
Is pregnancy going to interfere with it, with the treatment?
If you're going to be pregnant while we do the treatment?
Later, pre-treating a patient.
Okay. It can, because we have some hormones during the pregnancy, relaxing the loose and up the spine. Okay, so we do not know that. You should be able to carry on with some kind of exercises, during the pregnancy, maybe not throughout the whole pregnancy. Pregnancy can be a bit tricky, but it hasn't been shown that, pregnancy in itself makes the spine go worse or scoliosis go worse.
No, I mean after treating that patient, yes. Like I've seen 28, 20 is still childbearing age, so that's I'm concerned about.
You cannot be pregnant while you're treating. Okay, we can't help you then, because we do use a lot of vibration, and vibration will do certain things to the body and can be harmful if you're pregnant. So nobody can be. We don't want to have a pregnant person that comes to the clinic at all, because it's something where to go wrong. You don't want to be the one responsible, whether it's proven that it was our reason or not. If somebody's pregnant, we just say no. We can wait until the baby is born and maybe wait a year after that and then do some work on it. Usually the progression is not that severe at the age of 28 anymore, because we're not physically growing. So yeah. Yes? Oh, okay. I actually only seen one research paper actually looked at that, because I think there was a kidney transplant or something, because the scar tissue started pulling it. It's not something I could do anything with. I mean, this is scar tissue causing the scoliosis, not idiopathic on its own. You could maybe do some stretching to try to prevent the scar tissue. What happens is scar tissue usually starts contracting itself over the years, and that can be a sort of a problem. So I won't have a definite answer to it. I think you probably try to contract a bit, a lot of stretching.
Someone with post-organ transplant and come to you and can have the treatment normally, no problem with that. I mean, the vibrations won't cause anything for the organs.
It shouldn't be that invasive vibration. It depends on what on the condition, but it shouldn't be a problem. I mean, if they can do normal sports, if they can run after the organ transplant, then our treatment shouldn't be any problem. Sure. No worries.
What's the difference between kyphosis and scoliosis? Because I heard that they are very similar, so I'd like to know what's the difference exactly.
Oh, kyphosis is a normal curve to the spine. I mean, the thoracic spine, then it goes outwards like this. the chest thoracic spine. That's kyphosis. When that becomes excessive, then it becomes called morbus Scheuermann. Then you start having wedge-shaped vertebrae this way, and it's basically this. But it's part of the normal curvature. Scoliosis means that the spine is deviated sideways. Okay, lordosis is the normal curve of the neck and your lower back. And kyphosis is just the forward bending of the spine this way. It's not a diagnosis. I mean, if you're saying that you have a kyphosis, you have to have excessive kyphosis. I mean, kyphosis is a normal part of the spine. It's the normal curve of the spine. Okay, yeah, then it's called morbus Scheuermann. I mean, that's the medical term for it. At the early stage, not if you've gone older, but mild morbus Scheuermann is not bad. I mean, Jim Boyer was a famous dentist, he actually had morbus Scheuermann a little bit, actually increased breathing capacity. But if you have excessive, usually what happens is bones are already wedge-shaped. They become like multiple triangles, like you're building a stony bridge. When they're shaped like that, there's nothing I can do about it. If you look at the scoliosis cases here, not very clear, but you know, as long as the bone shape hasn't been deformed, if you have a curvature at 40, 50, 60, 70 degrees, they tend to start becoming a little bit wedge-shaped. That means that you will never be able to make it straight. If you have a 110-degree curvature, they're massively wedge-shaped. I mean, you can maybe bring it down to 90 after that. But then it becomes a problem. So even in surgery, when they start correcting this 100-degree curvature, what they do, they take the disc and scrape them out to allow the bones to be aligned. That's the only way they can do it. I mean, something's got to give. So with morbus Scheuermann, I mean, it's wedge-shaped this way. I haven't seen any case that they actually managed to fix it, you know, over the long term. They say that the bone replaces itself in every 8 years, but I haven't seen any case working. You can do something and work with the soft tissue, but I can't change the bone structure. Okay? I mean, the wedge will be the shape they are. We can work with the soft tissue around the bones, but if you support that the square blocks and they all built it, that's what reinforces the limitation. So likewise, when we talk about this congenital case, if the vertebrae are wedge shaped like this and you stack them up, that's good as you'll ever get. So whether we stack sideways or frontways,
we have some food and snacks outside. And anyone has any more questions?
Alright, thank you.